Indications for hydrotherapy. In subacute and chronic soft tissue injuries, the therapeutic effect of hydrotherapy may be decreases in swelling, and this would be due to the hydrostatic pressure of the water exerted on the part, hastening of the healing effect, as well as decreases in pain and spasm due to the thermal properties of water, increases in range of motion, as well as increases in strength due to buoyancy and the thermal effects of water, as well as buoyancy and the hydrostatic pressure of water. Another indication for hydrotherapy is for shortened tissues, contractures, and scars. The effect of hydrotherapy then causes relaxation, and this is due to the thermal and psychological effects of the warmth of the water. In addition, there is an increased extensibility of the non-elastic tissues due to the thermal effects of the water, and the fluidity and thermal effects of water have a therapeutic effect of softening scar tissue. For patients with arthritis, we see increased joint mobility, decreased pain, and increased range of motion due to the thermal and buoyancy effects of water. For patients with open wounds, the use of hydrotherapy as a debriding agent and a cleansing agent is very effective due to the fluidity and the pressure of the water. We also see an increase in circulation into the area of the wound due to the thermal effects as well as the hydrostatic pressure effect. For patients with muscle weakness, we can see increased range of motion due to buoyancy, as well as increased strength due to anti-buoyancy and hydrostatic pressure effects of the hydrotherapy tank. So it's important for you, the physical therapist, to be able to determine and ask yourself, what is the therapeutic effect we're trying to achieve for the impairment of this particular condition, and what is the specific property of water that's necessary to assist in that particular intervention. So it would behoove you to look at this chart closely and understand the correlation between the therapeutic effect and the properties of water. Contraindications for hydrotherapy include cardiac dysfunction, because it is possible that the heart cannot adapt to the changes needed for the thermal effects of the water. Respiratory dysfunction. We mentioned earlier that one of the effects of hydrotherapy is increased work of breathing, and so your patient may have an inability to resist that hydrostatic pressure or tolerate the heat or both. Another contraindication is decreased thermal sensation. So the inability to report overheating or overcooling needs to be carefully monitored in patients who may have decreased thermal sensation. For these patients, you should avoid hot or cold water, and recommend cool through a warm range of water temperatures, those being between 80 and 98 degrees Fahrenheit. For patients with severe peripheral vascular disease, diabetes, or arteriosclerosis, there's always a contraindication to the application of heat, so you need to avoid temperatures greater than 95 degrees Fahrenheit. If a patient has a surface infection, you don't want to put them into a hydrotherapy tank for fear that you may spread that infection to other areas of the body or possibly cross-contaminate other patients via the water. And for patients with acute rheumatoid arthritis, the application of heat would be contraindicated. So let's talk then about a few different types of hydrotherapy. Hydrotherapy can take the form of contrast baths, whirlpools, or Hubbard tanks. Contrast baths then are classified as a form of infrared modality that emits electromagnetic radiation. In this particular case, the wavelength and frequencies are dependent upon the specific temperatures of the bath. It's a thermal modality used for superficial heating and cooling of tissue. And the maximum depth of penetration is approximately 1 centimeter. It usually utilizes the conduction method for heat transfer. So a description then is we immerse part of the body into baths in which the temperature of the water alternates between warm and cold. The therapeutic purposes and goals then are primarily used as a vascular exercise. Because of the alternation between the warm and cold water, we see an alternation between dilation and constriction of local blood vessels. And the peripheral circulation then is stimulated, which may stimulate the healing process in damaged tissue. This may also then be used to promote pain relief and desensitization. Physiologic responses to contrast baths are vasoconstriction and vasodilation of superficial blood vessels. In addition, because of this, we can see a reduction in edema. Indications then include impaired venous circulation, subacute or chronic traumatic or inflammatory conditions. So this may be used during the transition period between acute and subacute stage of healing. Indications then are chronic edema, sinus or congestion headaches, in which case we apply the contrast baths to the feet or both feet and hands. For patients who have hypersensitivity due to reflex sympathetic dystrophy, RSD, or what is now referred to as complex regional pain syndrome, these patients often will respond well to contrast baths due to a reduction in their hypersensitivity. Contraindications for contrast baths are the same as for any superficial heat or cold therapy application. For contrast baths, then, we fill two adjacent containers with water. One container is filled with warm or hot water between 80 and 104 degrees Fahrenheit, with the other being filled with cool or cold water between 55 and 67 degrees Fahrenheit. It's recommended that if the intent of your treatment is for pain control, that you use a larger temperature difference between one basin and the other. If your intent of treatment is for desensitization, then the temperature differences should be small initially, but can gradually increase with each treatment as the patient's hypersensitivity decreases. So for a patient suffering from regional chronic pain syndrome or RSD, we may look to use temperature differences that are small initially and building up over time. Whereas if we're looking specifically to treat a patient with pain, then these larger temperature differences are more highly recommended. Whirlpools are classified as infrared modalities emitting electromagnetic radiation. And like with contrast baths, the wavelength and frequencies are dependent upon the specific temperatures of the water. It's also classified as a thermal modality used for superficial heating of tissue. Again, the depth of penetration is typically approximately 1 centimeter. Usually uses the conduction and convection method for heat transfer. It's a mechanical modality also used for debriding open wounds. Because a whirlpool typically has a jet or an agitator, it is classified as a method of heat transfer due to convection. However, the conduction method of heat transfer is due to simply placing the part into the water. The description of whirlpools are typically a tub of water which is agitated by an electric turbine. These whirlpools are generally made of stainless steel or some acrylic material, and they come in many shapes and sizes. They may be used for either heating or cooling depending upon the temperature of the water. Different types of whirlpool tanks include extremity tanks, which are used for the immersion of a distal extremity such as an arm below the elbow or a leg below the knee. You also have high buoy and low buoy tanks, which are used for immersions of larger parts of the body. For example, a patient may be able to sit in these up to their waist or higher. Therapeutic purposes of whirlpools are to debride open wounds. And additional therapeutic purposes are for the same as other superficial heating modalities or cooling modalities. These whirlpools can also provide a medium for therapeutic exercise due to the buoyancy effect of the water. And they can also be used to reduce pain. Physiologic effects of whirlpool is that it increases the hydrostatic pressure, which tends to increase the flow of lymphatic fluid. It also moistens and softens tissue for debridement. And the agitation of the water provides the following effects. It can provide a phasic stimulation to skin afferents. It can further increase the hydrostatic pressure of the water. It can provide a means for grading exercises depending upon how much water pressure is exerted by the agitator. It can decrease the thermal gradient within the water by incorporating room temperature air into the water. It can also remove debris and necrotic tissue from a wound and decrease the bacterial load within a wound. Indications then for whirlpool are infected, dirty, open wounds, including burns, subacute or chronic inflammatory conditions, and in this case you would want to use a warm whirlpool. For early peripheral vascular disease, remember in later peripheral vascular disease the patient may not be able to dissipate or tolerate the added heat. And for muscular weakness, because the whirlpool provides a weightless environment due to the buoyancy effect of the water. Contraindications for whirlpool are the same for other superficial heating and cooling modalities, as well as venous stasis ulcers. Cautions when using whirlpool: you need to be certain that the whirlpool is plugged into an outlet that's protected by a ground fault circuit interrupter, or a GFCI. This is to assure that there will not be a shock from the electric motor to the patient or to the therapist. When using a warm whirlpool for large body areas, you need to monitor for signs of faintness or fever within your patient, making sure that they can tolerate the increased heating effect of the water. You also need to monitor for signs of patients becoming seasick from the motion of the water. And in some cases, although these are very rare, you may need to actually drape the pool so that the patient doesn't physically see the water moving and become somewhat seasick. So common temperature ranges that are used for hydrotherapy are described here. A temperature between 104 and 110 degrees Fahrenheit is considered to be very hot. That between 99 and 104 is considered hot. 96 to 99, which is closer to core temperature, is considered warm. 92 to 96 is neutral, with 80 to 92 being described as temperate. And these would be the doses that you would have to consider depending upon your patient's condition and the treatment outcome you're looking for. The treatment duration for a typical hydrotherapy intervention is between 15 and 30 minutes for most interventions. Part of the reason for this is that the water temperature will attempt to equalize with that of room air temperature due to the typical conduction of temperature gradients between the room air and the water. So if we're using a cold water, it'll warm up somewhat due to room temperature. If we're using warm water, it'll cool down within 15 to 30 minutes due to room temperature. However, if our attempt is to utilize the hydrotherapy for therapeutic exercise and the temperature gradient is not that important in your intervention, then the treatment time will be more variable depending upon the patient being able to complete the exercises that are required for them. A Hubbard tank. The classification of a Hubbard tank is the same as a whirlpool. The description of a Hubbard tank is that it's a butterfly-shaped whirlpool designed so that a patient may be immersed in a recumbent position. Therapeutic purposes or goals of a Hubbard tank are to deliver heat or cold to large portions of the body or to allow for unweighted exercise. And this is what a Hubbard tank looks like. You can see from the picture on the right that we can immerse an entire patient right into the pool in a recumbent position, which can allow for debriding multiple areas on the body, as well as for use with therapeutic exercise for a variety of patient conditions. So throughout this presentation then, we discussed the physical properties of water, and I hope by now you have at least a brief understanding of the concept of heat transfer, buoyancy, resistance, and hydrostatic pressure, and how they are affected by the use of water. We talked about how hydrotherapy can be used as a cleansing agent, as a musculoskeletal support or resistance modality, for cardiovascular and respiratory training, and also the psychological benefits, the relaxation or invigoration effect of water based upon the water's temperature. We also took a look at the indications and contraindications for hydrotherapy and some reasons why we might choose a specific hydrotherapy intervention for a patient. We looked at and were able to develop an appropriate treatment intervention, including dosage and duration of intervention. We looked at some specific types of hydrotherapy, including contrast baths, and we explained the physiologic effects of contrast baths, the indications and contraindications for them, as well as the development of appropriate treatment intervention. We did the same for whirlpools and Hubbard tanks as well. The references listed here will give you additional information on the use of hydrotherapy as a treatment modality, and I would encourage you to continue to read the professional literature with regards to the use of hydrotherapy as a modality. Thank you for listening to this presentation on hydrotherapy and contrast baths.